Okay. You're on. You can't see us? Here, I'll move this. You're welcome. Okay.
What symptoms of each, or do you want like okay, so symptoms, like okay. So ask them that because they were confused on what you wanted to know. They were raising their hand. Oh, I was asking them. So first, that's it's not like that they're sympathetic to that. I didn't like underestimate, so that way it would have that symptom. I'm gonna put it under there like and draw a squiggly. So you just talk about right.
Perfect. Anticholinergic? Yeah. Okay, so we were talking about anticholinergic effects and how they were kind of similar. They were sympathomimetics, which means they block the parasympathetic system.
So they act like sympathetic nervous system side effects, however you want to do that.
Yeah. So name a couple of those. Anticholinergics, they block the parasympathetic effect.
Yeah.
So they act as sympathomimetics.
Because if you're like blocking parasympathetic, then you're not having any of those responses, so you would get the opposite of those, which is sympathetic. So basically how I learned it was I put like sympathetic nervous system, parasympathetic nervous system, and under that I would do like anticholinergic, and what's the other one that goes under it?
Adrenergic is sympathetic.
Yeah, adrenergic. So I do sympathetic nervous system, anticholinergics, adrenergics, then cholinergics, what's the other two? There's two more in this one. It's
you're doing like agonist, antagonist?
yeah, antagonist.
Is it like
Sympatholytic.
That one goes under PNS. And then is there one more? I thought it was yeah, okay, so in
Yeah, adrenergic antagonist.
yeah, those anyways, so we'll start with anticholinergics, which have sympathetic nervous system side effect kind of things, like effects, not side effects, effects. So what are some of those effects?
Yeah, okay, well I think actually, okay, let's take a step back. I think what we need to go over first is cholinergic. Do y'all know the cholinergic crisis? Shooting over that. Cholinergic crisis? The sludge.
Sludge.
Mm-hmm.
Do you want to come do it?
Yeah, will you?
Come do it.
She's like, again.
Hey, we should just repeat it from that board, so just because there's not enough room. So just run over there. It doesn't get nice. So it's sludge.
SL.
Yeah, it's like the effects of the PNS.
It's a cholinergic crisis kind of thing. No, yeah, keep writing it. You got the first one. What's the L? Does anybody know what L is? Lacrimation. U? Urination. Right. Right faster.
Right like a doctor.
Yeah, I know.
Anyone know what D is?
Defecation. And y'all know lacrimation is. Okay.
Okay, G. GI upset, GI symptoms. And E? Emesis.
So emesis is vomit. Okay.
Perfect. So cholinergics basically make you wet. So if cholinergics make you salivate, lacrimate, do all this stuff that's like wet, what are anticholinergics going to do? You're going to dry you up. So right, dry. There should have been a mnemonic in one of those books that was like anticholinergic crisis or something that we passed around at the beginning.
So this sludge happens whenever you're taking a drug that's cholinergic and you like have too much of it.
Yeah, cholinergic crisis.
Yeah. So like a cholinergic crisis happens if you're taking like a cholinergic drug, and you give too much, the patient will start getting these symptoms. And GI upset is like abdominal cramping. That's like one of those things. So usually it won't be like GI upset, she'll say abdominal cramps.
Okay, and then sympathomimetics kind of, you need to understand that like alpha and beta are completely separate from parasympathetic anticholinergic thing. They're specifically sympathetic.
Yeah.
So go ahead and write alpha.
This whole side of the board is going to be sympathetic. That's parasympathetic.
Yeah.
Okay.
So alpha 1. Who can tell me what alpha 1 agonists do? Agonist is promoter.
They do constriction like
Yeah, heart constriction.
You need to know like this. If you know, okay, you don't need to, I guess, but if you know like alpha 1, alpha 2, beta 1, beta 2, it'll really help you when you get to heart drugs, because those are like alpha blockers, beta blockers, and it kind of helps you know the symptoms.
Yeah, so alpha 1 is heart constriction. We'll get there.
Some of them have like similar.
Yeah, they have similar effects, but you just have to know like distinguishing
things.
What was your question? Okay, he's answering.
Textbook labels it under alpha 1 as blood vessels, and then it leads to heart contractibility.
Yeah, heart contractibility. What? Like it? Are you asking for like the blood pressure part? I don't understand.
No, I think what's confusing her is that in the book it says blood vessel I is bladder and prostate, and then it leads for alpha higher heart.
Yeah, those
Yeah,
are the
it
parts.
increases blood pressure.
Those are the
as
parts
well.
of the body that it affects. You need to know like the actual effect it has on that part of the body. Is that what y'all are getting at?
Basically constriction.
Yeah. So not like increased blood pressure.
Vasoconstriction. That kind of thing. You can write vasoconstriction there too. Oh. Heart contraction. But that's kind of the same. Yeah. Right? Okay. Right. Heart contraction and vasoconstriction. Because heart constriction is contraction. Okay. Who can tell me what alpha 2 receptors do? Are they clinically significant? No. Okay. That's basically all you have to know about alpha 2, other than they inhibit the release of norepinephrine. But they have minimal clinical significance. Okay, so now we're moving on to the betas. I'm going to tell you a little way I can remember beta 1 from beta 2. They both have similar effects, but beta 1 focuses on the heart. You can think of that as, oh yeah, this one. So beta 1, beta 2, you can rewrite this, but see the little B right there? Beta 1, you only have one heart.
Yeah.
And then beta 2,
Yeah.
you have 2 lungs. Does that make sense? Okay, yeah. So with beta 1, what kind of symptoms are you gonna see? Not symptoms, but what does it do?
Y'all know like HR, heart rate.
It also increases renin secretion and blood pressure. Okay, so beta 2, since they affect the lungs, what are they gonna do? Correct. Bronchial dilation. No. DILA. It's also gonna relax your GI tract and relax your uterus. What's gonna happen if your uterus is relaxed? Are you gonna wait? Hold on, not uterus. GI relaxation. Hold on. Yeah, bladder relaxation. That's it relaxes the bladder.
Uterus and bladder, or just bladder?
Both.
You don't. Yeah, but you don't need to know about the uterus. She's not gonna like. That's not something we.
Oh, that's later with diuretics. I'm going too fast.
We don't ever do uterus.
Not uterus, but I think it says uterus, but I think I missed bladder on the notes.
Yeah, usually the important ones.
Okay, so who can tell me the main sympathetic system drug? Epinephrine. What's the other name for epinephrine? Yep, adrenaline. Just type faster.
No, just keep going.
Oh, okay. Okay, so what are the actions of adrenaline? Since you know what all of these are, if you know what's incorporated in epinephrine, you can tell me. Increases heart rate. What else? Increased blood pressure. Bronchodilation. Opens your airways. It may. I don't have that on my notes. But if it's on your notes, then check. What route don't you give this drug by? Oral. Why is that? It's a pretty basic one. So epi is one of those.
Why
That-
would they give it? Ask them why they give it.
Okay, why would you give epinephrine?
Can I make a request?
Sure.
When someone says an answer in the front,
Repeat it.
repeat it.
Sure.
Because I can hear it.
You would give it for heart failure.
Shock.
Oh, well, okay.
Shock.
Like hypo.
Emergencies.
Yeah, it's an
like
emergency drug.
anaphylaxis, EpiPens, kind of stuff.
So like if they were having an allergic reaction, like a severe allergic reaction.
Do y'all want to go over all of the drugs, like every single one, or just know the basic categories and like one drug for each, and then go back over that yourself? Or would it help more if I went over every single drug? All of them? Okay. So another one for the sympathetic system. Give me another drug. Norepinephrine. What's the brand name for that one? What's it used for? Not necessarily. Yeah, you actually wouldn't give Levophed first. Yeah, you wouldn't give Epi first either. It's like you use it if what was that other drug?
This is the last resort.
Yeah, last resort-ish kind of drug. But yeah, hypotension, increased blood pressure when you have shock.
Don't you give dopamine first?
That's the one that I was going for. Yes, it's a potent vasoconstrictor, so it's going to constrict. That's why it's under alpha one. It's an alpha adrenergic. Do y'all know the difference between an adrenergic? I mean, not adrenergic, agonist and antagonist or antagonist?
Is norepinephrine the one you can't give? Can you give that in the IV? Or that's the one.
No, yeah, that's the one you have
Has to be
tissue
central.
necrosis at the IV. Yeah, you can't give it IV.
Norepinephrine.
Yeah.
You can't give norepi IV. You
I
need to
should have
repeat
the
it.
the microphone.
We don't have like that.
Okay, what are you gonna monitor when you're giving Levoped? Peripheral circulation, kind of. You would monitor their blood pressure and
So-
telemetry, so their heart monitor.
Yeah, talk about it. Yeah, I'm not gonna write all that.
Yeah, no, you don't have to write. Okay, another sympathetic drug used for shock. What is it? Dopamine. You'll have to know this one for like the rest of your life. Yeah, it's also used for shock. It vasoconstricts at a high dose, and it's alpha 1 and beta 1. So it constricts and is used for the heart. No, we went on to dopamine. Okay, I don't have the input, so I'm going to just write some. Sorry. I don't know if that's how it's Yeah, they do. Okay, so albuterol. Somebody tell me what it's used for. Asthma. Is it a beta selective or non-selective? Selective. What does it select for? Beta 2 because of the lungs, the bronchodilation. Okay.
It tells
Yeah.
us.
Yeah, I'll tell you. Okay, what are some side effects you can get? Moving back to dopamine, what are some side effects?
Increased heart rate.
Yeah, it's tachycardia, high blood pressure, and chest pain. So, who wouldn't you give? Okay.
What was the other side effect you said? It was tachycardia, increased blood pressure.
And where was that?
Chest pain.
Angina, yes.
Wait for dopamine. Yeah, dopamine just has like a lot of kind of heart effects, I think. Like the heart rate increases, the blood pressure increases. Doesn't it slow GI tract motility?
It doesn't say that on my notes.
Okay, and it dilates your pupils.
There's a new one with that. I remember in that book that you passed me.
Yeah, drag.
Yeah, drag.
Yeah,
That's how I remember that helped.
drag is for
Do you want
dopamine.
to write it?
Yeah, I'll write it. I'm running out of words.
Go look right here.
Okay. D is for dilation, like it dilates your pupils. R is for rate of heart, it increases the heart rate. A is for arterial constriction, because it increases blood pressure. And G is for GI tract motility, because it decreases GI tract motility. So drag, like dopamine drags us,
Around.
drags us away from the bear.
What's the A for?
A is for arterial constrict, so it increases the blood pressure. Because when your arteries constrict, your blood pressure goes up.
Okay, so we already know what adrenergics do. They help the sympathetic system. So we're now moving on to adrenergic blockers.
What does that mean? Someone tell us what an adrenergic blocker is.
Which receptors? No, you're right. Which receptors?
Yeah,
Oh, are we talking about which blockers we're talking about?
adrenergic blockers.
Alpha and beta.
Blocker is blocking the alpha and beta blockers.
Yeah, so we're talking about alpha and beta blockers. The drug you have to know for this is propranolol.
Wait, really quick. So if you're blocking the alpha and beta blockers, you would have what kind of response? Cholinergic.
You would have a cholinergic.
Cholinergic response. Sorry.
So you're blocking adrenergic. Just think if it blocks the sympathetic system, it's going to have parasympathetic effects. If it blocks the parasympathetic system, it's going to have adrenergic or sympathetic system effects.
So what drug are you doing for this first?
The propranolol.
Okay.
So is propranolol a beta blocker or an alpha blocker? It is a beta blocker, she said. Okay, what are you going to use propranolol for if it's a beta blocker?
So basically, sympathetic nervous system responses are like increased blood pressure, increased heart rate, things like that. So this would give a parasympathetic. So what would the responses be? Decreased blood pressure.
Yeah, so you're going to give it for hypertension. I did hear hypertension.
We moved to PNS then?
Basically, yeah, because it's
It is
blocking it's blocking the adrenergic.
So what is it?
Propranolol.
No, I know, that's what I'm looking for, 'cause that's how I'm.
Okay, so somebody said hypertension. What other uses can you use for it? Or what? Yeah, what other uses are there?
Wait, can I like clear something up really quick? Okay, so the reason I'm putting it under PNS is because that's the kind of response it will give you. It's beta adrenergic blocker means it blocks the beta, so it's blocking the sympathetic and having a parasympathetic response. That's why it's under this. Do y'all get that?
Yes.
Are y'all confused about anything so far?
But it's still an SOS drug.
Here,
Can't
scoot.
hear half of what you're saying, so like
Do we have a
Y'all wanna
microphone?
scoot up? We don't have a microphone.
Oh, we don't have a microphone. Yeah, there's closer seats. Just kind of move a little closer.
If you don't.
We both kind of have quiet voices, so we're trying to talk as loud as we can. It's hard.
Sorry, guys.
And we don't have a mic, or else we would put it on. Okay.
And I'm gonna put this like recording on Facebook anyway, so.
Don't be stressed. It's okay. We're trying to make it as easy. It is a really hard concept to get. Yeah.
Okay, so even though it's under this category,
It's still a sympathetic drug.
under this category, you're just getting these.
I like effects.
Yeah, I like to
Yeah.
divide them up like this because I think PNS responses like all go together and ANS or SNS responses all go together. So that's why I like split it like this.
That's, yeah.
Yeah, because it didn't make sense to me. Like I know in class she doesn't do it like that, but this I think makes more sense because the responses.
You say one of the drugs is has a PNS effect, but it's an SNS drug.
That's
Okay,
what.
in class she will put it under the SNS.
It's a blocker. You're blocking the sympathetic nervous system.
Yeah.
So you're gonna have parasympathetic nervous system like effect.
Yeah, I think you're right.
Yeah. And blocker and agonist, they're just you're gonna have to look for those key words. If it's blocking, you're gonna have to know what these do. Then it's blocking. Does that make sense?
Exactly.
So yeah, we're on propranolol, and the reason you can remember that it's a beta blocker is your beta blockers have OLOL. So your LOL drugs. Beta blockers equal LOL.
So this one isn't the
It bronchoconstriction. Yeah, that's its negative. Right, you wouldn't. Or asthma, yeah. This is a non-selective beta blocker, so it's going to have heart and lung effects. It's going to have both of these. So who wouldn't you give it to, which is her question she was asking. COPD, asthma, anybody who, if you would have lung effects, it would be bad because your negative effects of this drug are going to be bronchial constriction and then bradycardia, all your heart stuff, but your lung stuff as well.
Yeah. So you wouldn't give it to COPD, asthma, or someone with congestive heart failure.
And that's because it's non-selective. It doesn't select for just one of these. Okay, so what is your beta-1 selective blocker? Does anybody know the drug? Atenolol.
So it's
What's the other name for atenolol? Tenormin. It's used for hypertension and decreased cardiac workload. So you're gonna be dizzy. You're gonna have a low pulse. Okay, so we're gonna move on to cholinergics because I think that's all you have for the sympathetic.
Oh, this one also is Inderal, and I think it like aids hypertension.
Yeah, you kind of have to come up with your own mnemonics for these drugs.
That's how I did it. Was like I thought of something really funny or cool to go with the drug. I remembered it like that. Yeah, HTN is hypertension. If you're like,
Okay, now I have to look at your cholinergic drugs. Okay, bethanyl chloride urocholine. That's going to be a cholinergic. Do you want to write that?
yeah, there's actually a mnemonic for this one too. I'm writing it over here, but it's still PNS. I'll write it. You keep going.
Oh, okay. So it's a direct-acting cholinergic drug. Somebody tell me what it treats. She said urinary retention and abdominal distension. So it's going to increase urination. Think of your sludge. It's making you wetter. So it's going to help you pee, basically. Because a lot of patients, and you'll learn this later, but a lot of patients when they come out of surgery, they've been dried up by atropine and they need to go to the bathroom. So that's where that comes in. And it contracts your bladder. If your bladder is contracting, that means you're going to be urinating. If it's relaxed, if your bladder is relaxed, it means you're going to be holding in your urine. That's kind of a hard concept because you think relaxing, you're going to the bathroom, it's relaxing. But it's opposite.
Okay, and the thing for this, I'm still writing it, but urocholine, the things you want to remember about it is it causes syncope, tearing, because remember you're wet, and also urocholine, if you remember it, like cholinergic, is in the word, so you can remember it has like cholinergic responses. So the mnemonic is stupid, S is syncope, T is tearing, U is urgency, because they like gotta pee, P is prior to meals because you want to give it prior to meals, and she loves those questions. Just by the way, she'll ask you like, should you give it like an hour before meals or like with food or stuff like that. So y'all kind of, if it says that, you need to know. I is going to be I's and O's, which is input and output, and D is diaphoresis, which is sweating.
Okay, the next one I'm going to do is Detrol. Do y'all have any questions on this other drug over here? Sure.
Okay, it depends on what the patient needs, like, and it depends on their previous complications. So, like, if they have congestive heart failure or like lung problems and stuff like that, you wouldn't give beta blockers or alpha blockers. You would give something that doesn't do those. Like, it just depends on the patient and what their prior problems are.
Yeah. You have to take into consideration like their side effects, the side effects of the drugs and what the patient already has, basically.
Did that kind of answer it?
Yeah.
Pretty much you have to like put it side by side and see which one.
Yeah.
Which one is better for that patient?
You have cholinergic agonists. I see what you're saying. Cholinergic agonists and then sympathetic blockers, they're going to have the same effects. Yeah. You just have to take it into consideration. Okay, any more questions on urocholine? The
The next one we're gonna do is Detrol. Somebody tell me what you use Detrol for. Overactive bladder. So I think of this one as you have the little old lady who can't control her bladder and she has to wear Depends, and it's a detriment on her life. So Detrol, detriment. That's what I do. So it's anticholinergic.
Wait, it's
It's anticholinergic.
so it's not over here. So that would mean it has sympathetic effects.
Oh yeah. And it's Detrol. Spell that. Detrol. Okay, so side effects that you need to teach your patient with any anticholinergic. Do y'all remember those? Did you teach all those? Patient teaching for anticholinergics? No. Okay, it's basically teach them the side effects. So anticholinergics make you dry. So you're gonna have dry mouth, constipation. Huh?
Like stay out of the sun.
Stay out of the sun. You're gonna have blurry vision. So wear sunglasses. Increase your fiber because you may have constipation. It's going to dry you up. Avoid overexertion. You're going to have decreased sweating, and sweat is the body's temperature regulation. So if you're not sweating, you're going to have hyperthermia, and it can cause a heat stroke. But I don't know if that was a question. I don't think so.
And that's the medicine you take for
No. Yes. Because you're drying up.
what are the side effects? When you give that medicine,
You would give that medicine if somebody like has constant urgent, like they're peeing themselves. Like I said, the old lady who can't control her bladder overactivity.
Okay, there's like a really cool mnemonic for the anticholinergics too to like remember what they do. I don't know if she showed y'all this in class, but like the little baby and it's like can't pee, can't see, can't spit, can't. Yeah. So that's anticholinergic. The
So
side effects.
the side effects are all the same.
For anticholinergic, for the most part, yes.
Okay.
Sometimes a drug will have like some random weird side effect, and if it does have something that's super out there and different, like remember that for that drug. But for the most part, yes, they're all the same. That's why you learn the class. Huh? Can't see, can't pee, can't see, can't spit, can't. Yeah. Yeah. Yeah, and the last one. It's spit in.
She says can't sit.
Yeah.
That's right. No. Okay, so what's your emergency drug that is your anticholinergic? One you would use during surgery. Your anticholinergic. Atropine. Okay, what is it used for preoperatively? Yeah, decrease salivary secretions. It increases your heart rate. It dilates your pupils.
Why would you want to decrease salivation if you're pre-op, like about to go into surgery? Yeah, so you don't aspirate. Yeah, aspirate your spit. But.
So again, you're still going to have dry mouth, decreased perspiration, blurry vision, tachycardia, all those things that you have to teach your patient about. Like this is what's going to happen.
What's a really important thing with these type of drugs, the SNS symptoms? Like, what would we do for that patient if they're on like atropine? What do we give them?
You're there.
Yeah, I know what you're talking about. It's the drug that makes them not constipated.
Yeah.
Laxative.
Wait. Yeah, like because they can't poop. You give them a laxative, something to help them poop. Yeah, exactly.
Like Colace or.
Yeah, that's just like the symptom of this is constipation. So you would give them, and if they're on these drugs, that's like a side effect that's unwanted. So you would want to give them something to counteract that side effect.
I have a side note that the Rexulene, the antidote is atropine.
That's good to know. Yeah.
What did you say?
The antidote for urcoline, or however you say it, urcoline, is atropine. So, like, if you give too much urcoline, they're having this sludge. If sludge is going on, like you gave too much urcoline, so you're having all these sludge symptoms. You're like, oh no, I need this really bad.
pooping everywhere. You give atropine. Yeah, and it reverses it. You'll remember it though. Yeah. And sludge is kind of like wet and nasty, so. Yeah. So what other drugs do they need?
I'm trying to find Cohentin.
Cohentin.
But isn't Cohentin the same as Artane?
Not sure.
I think it is. Because we don't have that one.
Do y'all know what Cohentin does? Yeah, it is.
Yeah, it is the same one then.
Okay, urocholine is for like
Bladder, it's for
Yeah.
urine retention.
like post-op. Sometimes patients will like not be able to pee because their bowels and like
From the anesthesia, they'll be like
they're sleepy, like the insides are sleepy, so they can't pee, they can't poop. So this gets them like moving, gets the urine flowing.
Yeah, just it's kind of the opposite of the destrol.
Yeah, like that's why atropine reverses this, because atropine's like, we're going into surgery, we can't have them peeing everywhere, vomiting everywhere, spitting everywhere, so we need a drama. And then this is post-surgery, we're like, okay,
They
we need to
can't
start
pee,
again.
yeah.
We're human again.
Does that help?
Yeah.
Okay.
It's for urinary retention.
So the stupid is not the one for your choline, it's sludge.
Okay, urocholine, stupid is the side effects, like the what happens when you take urocholine, like things you need to remember. This sludge is any cholinergic or like beta adrenergic or beta blocker or like, yeah, any kind of PNS thing. If you give too much PNS drugs, they might get sludge. This
Which
is like
is your
bad
cholinergic
side
process.
effects. Yeah, if you start like speeding up their valves and bladder and things like that, you might.
They're gonna be sweaty. They're gonna be like peeing themselves, kind of stuff.
Yeah. And then you would give what? If they're going through sludge, what would you give? Yeah. I feel like don't want to.
Mhm. Yeah, that's for Parkinson's. She said it was for Parkinson's. I don't know if all of y'all heard that, but somebody said. Y'all have a different drug than us. It's Cohentin, benztropine. Cohentin is for Parkinson's. The Parkinson's symptoms. The involuntary movements in Parkinson's. So it's going to block your cholinergic muscarinic receptors. We didn't go over muscarinic or nicotinic. We didn't go over muscarinic nicotinic. Okay. Yes.
To help remember with the benztropine, Michael J. Fox has Parkinson's,
Uh-huh.
and he can't drive a Benz.
Perfect.
Doesn't need to drive a Benz.
Okay, so what?
That's the entire
To help remember benzotropine, which is also known as Cohentin, Michael J. Fox has Parkinson's, and he can't drive his Benz because his muscles are all like twitching.
She thought that was funny. What's something that's really important to remember with all kinds of anticholinergic drugs, including benztropine? What is it contraindicated in? Patients. There you go.
Good job.
Yeah. Why is that?
Wait.
She said narrow angle glaucoma. It's Okay. Any anticholinergic drug, just like benztropine, I think that's what it's called. What is it? Yeah, benztropine. Y'all had a different one than us. Is contraindicated in narrow angle glaucoma, and it's because of your increased ocular pressure. No narrow angle glaucoma.
Yeah, I think they have it. It's a no-no.
You spelled glaucoma.
It's contraindicated.
Narrow angle glaucoma. You don't want to give anticholinergics to patients with glaucoma. Okay. Okay, we only have one drug left. I'm pretty sure that I skipped it when we were going over cholinergics, and it.
Can I do a pop quiz?
Yeah, go ahead.
Okay, Cohentin. what are like undesirable effects? Because it's on this side, what are the undesirable effects for cohentin?
Binge choking.
Binge choking. Huh? Constipation. Yes.
Urinary retention.
retention.
Tachycardia.
Yep. What else? What did we talk about? Like the other drugs, some of the things they do. Nausea.
I'm like,
Yes. Dry mouth. Yes. Also, we talked about something with the. What?
Increase
increased
Blurry eyes.
ocular pressure
That's
is
what I was thinking about.
contraindicated.
Yeah, that's one too.
Mhm.
Yeah. So
Decreased
basically,
sweating.
once you know all these symptoms, they kind of go with all the drugs. We just use the drugs for different things because they like work better for that particular side effect. Like they have one in side effect.
Did you have a question?
This one? Okay, go ahead. Sorry.
Okay, yeah, the last drug, I skipped it when we were going over cholinergics. It's neostigmine pyridostigmine. And it's for myasthenia gravis. It improves your muscle contraction.
You want to spell that for me?
Yeah, it's neostigmine is neostigmine. INE. And then prostigmine. Pro. And then stig. And then MINE. Okay. Some side effects. Does anybody know some side effects of this drug? It is not. It's a cholinergic. I'm sorry. I'm skipped back because I skipped it when we were talking about cholinergic. It is a PNS.
So what would the side effects of this one be? It's a
No, it's a cholinergic.
drug. It's a cholinergic. So PNS.
Diaphragm. Salivation. And diarrhea, yeah.
Good job.
So all those wet things.
So sledge.
It's for myasthenia gravis, for their muscle contraction. It improves muscle contraction. Because in myasthenia gravis, you're going to have like decreased muscle contraction.
Do y'all know why? I'm just gonna write this sheet.
Yes.
Yes.
It increases, what she was saying is it increases acetylcholine at the receptor sites. That's how it improves muscle contraction. What's its antidote? If it's a cholinergic, what antidote would it have? Atropine.
Good job. So basically, another way I remember what this is for is because, like, sympathetic nervous system, you're running from the bear, you're like having, you're like able to move and stuff. So if this is a cholinergic, they're having problems. They're like slowing it down, so they're not having like the shakes and things like that. Yeah. It like slows down movement because PNS is like rest, digest.
It also says to take before meals. That's just one of those. Remember to take it before meals because she'll have questions like that. So you'll be like, oh, did it say to take it before meal? Did it say to take it 3 hours before?
Don't take it before meals because why?
You do take it.
Take it before meals.
Because why?
GI upset. If you certain drugs, if you don't take it with food, then they'll upset your GI.
Yeah. That's all the drugs.
Yeah. So do y'all have any questions or like need to go back and clarify anything? Like, there's no dumb questions. Seriously, this took me forever to get.
Yeah, it's really difficult concept. It's pretty
I mean, it's not the time we're supposed to be taking medicine. Yeah. The reason. Okay. So I feel like if you know the side effects, you can get the nursing implications. Like, let's talk about that now. So.
I had it together.
Your patient has a dry mouth. What would you do? Because they're on sympathetic drugs.
They're on anticholinergic.
Yeah. You would do what?
Hard candy,
Hard candy, ice chips,
gum.
gum. So they have dry skin.
Yeah, non-scented lotion specifically, but a lot of nursing implications like teaching. I mean, yeah, nursing considerations are like patient teaching. She'll ask you, what do you need to teach the patient?
And
Let me ask some more. So they have blurry eyes. What would we do? What are they? Yeah, but what would you put the patient on because their eyes are blurry? They can't see, so they are a
you can, but the thing is, it's systematic.
Pharm. Yeah.
You're not going to
They're
be
Pharm.
excreting it
That's like
anyway,
their
so that wouldn't really help.
So they're on safety precautions.
Yeah. Well, you increase fluid
Yeah, if your
intake
patient
with
has blurry eyes
a
or
lot
any
of
kind of
things
like
anyway.
impairment,
Just
like
use your best
myasthenia gravis and stuff,
Yeah.
they're a fall risk. So. What would we monitor? What would we monitor if we're giving a anticholinergic drug? Sorry.
Urinary
Eyes and
output.
O's. Input and output. Because why? Dries them up. Urinary retention.
Yeah, you're retaining fluids. You want to know if it's being excreted or not.
So also you're saying like sugarless gum. What else do we need to do if they're dry and they have a dry mouth? Keep it clean, that's good. Dental hygiene is really important when your patient has a dry mouth. Also, no one said this, but increase the fluid intake. If they're dry. Yeah.
Oh, then yeah, it would be. She said it.
Oh, I'm sorry.
I was
didn't
talking to
hear
her
you.
about it. Okay, then.
So can't poop, but starts with an S. That symptom. What do we do for that?
More fluid.
More fluid. What did you say? Yeah, laxatives. What do we do before we give a laxative? We want to start like least invasive to most invasive.
Prune
So
juice.
prune juice is good. What else? Increase fiber. Yeah. So.
Yes,
These people
that's a
have
good-
blurry vision, so you want to kind of be careful with that.
Oh, I thought you were just talking about
Okay,
like,
yeah. If they have constipation, yeah, but you keep that in mind. They have blurry vision, so if you're gonna ambulate them,
on this
right?
drug.
Yeah. Okay. So your patient has syncope. What do you do for that?
Fall
Do you know
risk.
what syncope is?
They're a fall risk.
Yeah, it's like Disney training.
Yeah,
They're
thanks.
fall risk. Okay.
She did
You
it.
don't want to stand up quickly.
Yeah, you don't want to stand them up quickly. That's a good one. The patient has urgency. What do we do for that?
Check frequently to take them back.
Yes, yeah. So you might, every couple, like 15, 20, 30 minutes, you go in there and say, oh, do you need to go to the bathroom? You might want to put like a bedside commode by them so they don't have to like get up and like go because when they need to go, they're going like right in. So. Why do we need to monitor the eyes and nose on this?
Because they need to be putting out what they're taking in.
Exactly. They're like
Yeah.
having a lot of fluid moving through them, so you need to make sure they're getting that bath. Like, especially like if the patient has diarrhea, vomiting, anything like that, you watch their eyes and nose because they can get very dehydrated and have like fluid and electrolyte imbalances. So, diaphoresis, that's
Sweating.
I guess, I mean, change the linens frequently. Yeah, change the linens frequently, make sure they're not, because, oh yeah, you're right, changing the linens really frequently because pressure ulcers. Pressure ulcers happen really easily with like wet and moist.
Yeah, decreased skin integrity. Yeah.
Wait, what? Oh, that one, exactly.
She was just saying.
It would cause a maceration on their bottom, maybe. If you didn't change their linens, they would say.
Yeah, that's maceration from. That's the thing about like nursing competencies at Pharm. They kind of like mix. So if you're like studying this, you might want to like intermittently study that. They go really closely together, especially when it comes to nursing intervention. So, what about diarrhea? What would we do for diarrhea?
You would up their
Increase fluids,
electrolytes,
up electrolytes. What did we just talk about with this?
atropine.
Yeah, atropine. That's a good one. But maintain their like skin integrity because yeah, that's easy to get pressure ulcers or skin breakdown. Or
their acidic.
the acid breaks down the skin. Yeah. Emesis. What do we do for that? We bring them a emesis basin. Yeah. I think that's nursing intervention. Do y'all have any other
Skin
questions?
integrity? Oh.
I didn't do well.
If the patient has something like renal failure or like they're not, yeah, if they have renal failure or heart failure, anything like that, you wouldn't want to do that because that'll like cause a lot of problems. It just depends on the patient. You do your nursing interventions like you try to run the warm water over there, you try to walk them and stuff like that, and you also could give like
Yeah, like
or you
turn
could
the
give-
faucet on. Have him actually sit on the toilet.
Or in last resort, you could give your choline. Yeah, that's why a lot of times, like pre-surgery, post-surgery, they kind of oppose each other. So, okay, so I think the last thing we can do is I'm gonna erase all this, and then I'm gonna pop quiz y'all. Do it.
He's ready. Right here. Wait, no, it's not.
Get the erase right there.
Okay, do we have a sign-in sheet? Or erase that?
No, we don't.
Oh, okay.
I need to see that.
We don't, but we're
Does someone have a newspaper?
Carson has it.
Will you, she's not coming.
I know, that's why.
Write your name and email address on that and pass it around. Everyone sign our sign-in sheet. We're giving it to y'all's professors, so.
Good question, Haley. Let me. I just want to stress to y'all that it is a hard concept, and Safety confused us last year too. So we had to teach ourselves. So don't feel bad for it being like complicated and not knowing it right away. Like it is hard.
I strongly recommend going back to your book and reading that. That like, especially if you have Miss Avery, that like clears everything she says up and like clarifies things.
Yeah.
Yeah. And make your own little poster if you're like a visual, like big picture person like that.
Get in a group, bounce ideas off each other. I don't know.
Yeah.
Different things.
Okay. So I'm gonna tell you the drug. You're gonna tell me if it's sympathetic nervous system or parasympathetic nervous system, and then someone's gonna tell me like what it does, stuff like that. Okay. So Shakori, adrenaline.
Adrenaline. It's easy. Adrenaline.
That's okay. So what category is it?
Sympathetic.
Sympathetic. So it's sympathetic. It's also known as epinephrine. Someone give me a side effect. You. Yeah, high blood pressure. Yeah. Why would we give the drug? You.
I guess if their heart rate's going down, like an emergency situation,
What kind of emergency situation?
cardiac arrest.
Or like any kind of yeah, shock. And is that the first drug we would give? Yeah. What's the first drug we would give?
Dopamine.
You can do it. Tell me what it is.
I just answered the other.
No. Tell me what it is.
You did.
Dopamine. Yeah, correct. Okay. Anyone want to throw in some more symptoms for that? Adrenaline.
Epinephrine.
I know chocolate.
Huh? What was that?
I know chocolate. Increased heart.
Yeah, what's that word again?
Increased heart rate. Heart contraction. Okay, yeah, good.
My dry stuff. Yeah. Dilated pupils. Let me go over.
Y'all are good with that vocab, guys.
Don't give it orally.
Don't give it a one.
Don't give it orally, yeah. Right?
Yeah. I'm just gonna. You keep going.
Okay. Is it?
Yeah, something about
Like don't.
Okay. So I'm just gonna throw y'all a random question out there.
All right.
How do you give Levophed? How don't you give Levophed? Yeah, don't give Levophed IV. Okay.
My peripheral. You can't give it like centrally?
Yeah.
Oh, yeah.
Yeah. Central. IV, it has a place for you to like put it in.
Oh,
Yeah. It just goes straight into their heart.
okay.
And like yeah, it's usually like right up here or like right here, like flavian, subclavian. Okay. A tittle. You. Great. I'm calling you out. A tittle.
Think LOL. Yeah, what kind of adrenergic blocker? What specific? Just beta. Is it selective or non-selective? Atenolol? It's non-selective.
You told us selective.
It wasn't selective.
Oh, sorry, I'm thinking propranolol. Sorry, my bad. You're right. I apologize. Bad question for me not to answer. Propranolol is the one that is non-selective. Atenolol is selective.
Yeah, propranolol is selective.
No, propranolol.
Oh yeah, because it does all the beta. Okay, yeah.
That's the one you don't use.
Okay,
I'm
so
sorry.
atenolol. Give me some side effects. Yeah, dizziness. What would we give that for? Yeah. So hypertension. Oh, there was that. Okay, I forgot to mention that. Atenolol, you monitor their blood sugar if they have diabetes, like really closely. Okay, when do we? I forgot to mention this too. This is important. When do we like hold atenolol? Did you talk about that with y'all? Yeah, it's when it's under 60, or when their systolic blood pressure is under 90. It's 60. Yeah, I think it's 60.
That's when you hold.
Yeah, you don't give it.
Okay. The blood sugar's under 60?
No, blood pressure. Blood pressure.
Their heart rate's under 60. Heart rate under
The
60.
systolic is less than, did you say 60 or 90?
It's 60. I was saying the systolic blood pressure. If that's under 90, you don't give it. Okay, if their pulse is under 60,
Okay.
don't give it. If their systolic blood pressure is under 90, don't give it. Why? Someone tell me why.
It'll lower it even more.
Yeah, it's a hypertension drug that's going to lower their blood pressure. So you don't, if they already have low blood pressure, you don't want to lower it even more. They'll pass out. Yeah. Those are important to know. Like, if you didn't write that down. Okay. Probentil, albuterol. You wouldn't think. No. Okay, you behind her. Albuterol. What is it? Is it sympathetic or parasympathetic?
Think LOL. If it asks.
Okay, tell me Shakori.
Does anybody know?
Sympathetic.
Yeah, it's a beta blocker and it's sympathetic. Yeah.
Which means it has parasympathetic.
And it is selective.
It dilates because beta 2 in the lung, remember? It's a beta 2 selective beta 2. Okay.
Parasympathetic effect. That's your warning.
The parasympathetic, yeah. Yeah.
It's a block. Atenolol?
Atenolol, yeah, it doesn't. Albuterol.
Albuterol is the.
Albuterol is
We're on albuterol.
yeah, we're on albuterol.
Oh, then yeah, you're right. Albuterol. You're right.
So write that on board.
So it's not a block?
It's not the OLOL. It has an LOL, but let me write it.
Okay, it's a beta 2 adrenergic agonist. Yeah. Adrenergic agonist.
Okay, let me write this.
So it stimulates the beta receptor. So it's sympathetic. Is that?
And atenolol. Those are the beta blockers.
Yeah, sorry, I just confused y'all. Guys, it's a sympathetic drug. It stimulates the beta 2 cells, and that means it like affects the lungs and helps them breathe. It's for asthma. Yeah.
Another way to remember this one, albuterol and the second proventil.
Yeah.
You're preventing an asthma.
That's how I remembered it. Yeah. So if you want to remember Proventil, it like prevents an asthma attack. Yeah. That is
That's the brand name.
the brand name. Yeah. And it's a beta 2 adrenergic agonist, which means it's sympathetic effects. Yeah. What kind of undesirable effects would we have with it?
High pulse. High blood heart rate.
Oh, albuterol. Y'all, I get mixed up too. Sorry.
Albuterol. We're talking about albuterol. Sorry.
Okay, then, yeah, 'cause I wrote the same one over there. Okay, y'all, sorry, I'm not in it today.
Okay. So what we remember with this one is it's for asthma, and anytime like the respiratory therapist comes by, I think this, if you haven't sick, she's probably told you this. You'll come back in after the respiratory therapist is left, and they have their Proventil. That's what I'm gonna say now.
Proventil.
Proventil,
Okay,
so
I
y'all-
got them all
yeah.
mixed up.
Okay.
Oh.
When they get that, you come back in and you're like, oh my gosh, my patient's like shaking and nervous. That's because they just got their Proventil. Yeah, that's like the side effect of it, is like shaking and nervousness. Like tremors, yeah.
Now that we got that.
And then because it's a sympathetic nervous system drug, it has tachycardia and hypertension. Yeah. Okay.
Are y'all passing around the sign-in sheet?
Okay. So norepinephrine, levophed. What side is it on? Parasympathetic or sympathetic? Yeah. Good. Okay. What are some symptoms or side effects? Huh? Yeah.
Yeah. So hypertension.
Yeah. What would we give before we gave that? Good job, guys. Okay, so tell me about dopamine. What's its other name?
Inotropy.
Yeah, exactly. Okay. So what side is that on? Sympathetic, yeah. And what do we give that for? Shock. Yeah. And that's
The last resort.
no, that's the first one.
First resort.
That's like the gold standard when you're doing shock. Okay.
Yeah.
The levotide and the adrenaline are the last resort ones. Like the norepinephrine and epinephrine are last resort. Okay. What is Ingerol for? Propranolol. Ingerol? Propranolol? Yeah. Beta blocker. Yeah. To decrease blood pressure. Yeah, so are y'all kind of seeing that like all those drugs kind of do the same thing, have the same effects? That's why it's easy to remember just sympathetic drugs and all the side effects. Yeah. Okay. So uracil. What is the mnemonic for uracil? Stupid. Stupid. Someone tell me what stupid means. Syncope, urgency, proximals, eyes and nose, diaphoresis. Yeah, good job, guys. Why do we give that? With their what? Yeah, urinary GI. We give it we give if we gave too much uricoline?
Atropine.
How are y'all gonna remember uricoline? Yeah, cholinergic. And ur for urine. Yeah. Okay. So what happens if we give too much uricoline or too much of a parasympathetic drug? Sludge. What sludge? Wait, S is salivation, lacrimation, urination, diarrhea. Emesis. Good job, guys. It's GI upset, like abdominal cramps and things like that. So, like, okay, what's Cohantin for? Benzotropine. Cohantin. Parkinson's, yeah. How are y'all gonna remember that? You can't drive a spin. Good job. Okay.
I've seen Michael J. Fox now.
What do we give? What's atropine for? Why do we give that? So that, what does it dry up?
Salivation.
Yeah, for surgery.
So we give
Yeah,
them surgery.
it dries you all up, but the main reason is salivation.
Peeing or aspiration.
Yeah, aspiration. Good job. So, and it's also an emergency reversal of uricoline. Okay. Detrol. What is that one for? It's also known as properidol.
Yeah, that's the old lady that says detriment.
Yeah. Good job. Aggressive bladder. Yeah, aggressive bladder.
Any other questions?
Oh wait, neostigmine.
Oh yeah, pyridoxine.
Used for myasthenia gravis.
Myasthenia gravis.
It's what size? I think y'all are good. Y'all are doing way better at remembering this than I did. So y'all probably counted this.
Yeah.
Oh, okay, yeah. I thought it was
I hope we didn't confuse you.
You're welcome.
Alright, and if y'all